Hi, I'm Dave Ziegler, and I appreciate you joining me today for a discussion of attachment. What we're going to be doing is, first of all, talking about what attachment is and why it's important, and then in the companion DVD, we'll be talking about what you do about it and how you improve it. Let me start on the basis of giving all of you a little bit of hope if you've worked with kids with attachment disorders. It is very common in my 43-year career of being a family therapist and psychologist to hear people say, including funding sources and mental health professionals, that attachment's too complicated, it's too difficult to understand, and really we don't know what to do about it, and maybe we can't do anything about it. I want you to know that in my career, we have had amazing success in giving kids with attachment issues the right kind of help and seeing profound kinds of changes. As a matter of fact, in our residential treatment program, attachment and improving the relationship skills is one of the areas that kids actually grow and expand and improve the most of all the things that we do. All right, so let's get going in terms of understanding attachment. The concept of attachment may be best described by John Bowlby, who developed the attachment theory about 50 years ago. And Dr. Bowlby describes it this way. He says, attachment is a complex weave of survival and adaptability combined with fixed action patterns in a feedback loop with the environment. Now there's several concepts within that description that are important for us. One is the instinct. The other is survival. The other is a fixed action pattern and a feedback loop. All of those we'll take a look at. So quickly, survival. The issue with survival is important because the human brain's job is to promote the survival of the organism. And so attachment is how we develop survival instincts right off the bat, because the brain has got to promote the sustainability of the organism. And human beings are the least suited for survival at birth. And so we have to bond, we have to attach in order to live, to be protected, to eat, etc. And so attachment is critical, and it's all about survival. Survival has to do with socially connecting as well. And so the neurobiology of attachment is a fascinating study where we learn how the brain connects with the brain of the primary care provider in this interactional loop that's really important. And the other concept is adaptability. The brain has to adapt in order to promote survival. All of these are instinctive in nature. So the feedback loop. The child is wired to connect with often the mother. Kids connect first with mothers and then with fathers. Sorry dads, but we start with mom. In this interactional loop. And the instinct in the child connects with the instinct in the mother. We forget that we're animals, and there's instinct that works on both bases. The mother is also wired to connect to the child. When that wiring goes bad, for example, with drugs and alcohol in utero, during pregnancy, we can have some serious problems on both ends, and that wiring is disrupted, and sometimes that can result in attachment problems, child abuse, neglect, etc., etc. So reciprocity begins very early on between the child and the mother, and attachment begins to connect and grow, which is the normal, healthy process. Secure attachment is a critical element of the long-term survivability and thriving of the human being. So some of the research around the security or the importance of how secure an attachment is says the following. The secure attachments have been found to be associated with competency in toddlers and preschoolers. It's been found to be predictive. A mother's attachment with her own mother is predictive of the attachment with her child. A secure attachment increases the competence with peer relationships, with positive disposition, and higher levels of empathy and understanding other people's feelings. Other research has found that infants with secure attachments are more enthusiastic, they are more persistent, and they are more cooperative. And isn't that what we want from kids? So attachment theory is involved in the understanding of attachment, and attachment theory was John Bowlby's attempt to understand the behavior of kids around connecting with primary care providers, particularly if they lose that connection. So traditional attachment therapy talks about physical attachment and connection. It talks about things like an inner working model or an internal working model, which is where the child begins to perceive their environment based upon their own perceptive development. And how we all see the world is the world that we experience, whether it's positive or negative or fearful or exciting. It all depends upon our perspective. Another concept in attachment theory is set points, where we understand that we develop an emotional, affective response to the world around us, and we stick with that kind of response over the long term in terms of growing up and maturing. And so you will find adults that have similar affective or emotional responses to the world, similar to what they had very early on in their life. So the physical element of attachment is the connection between the mother and the child. It includes being nourished. It includes being warmed as an infant. It includes safety, all of these things. So there's a very clear physical component. There's also an emotional component to attachment, having to do with the child being understood and feeling like the care provider hears and responds to them. And there's also a social component having to do with not only the mother but also others in the environment. Now, to the traditional attachment theory, I have added, in my understanding of kids, a spiritual component, because I believe the first attachment that children have is a spiritual connection to something that they are a part of that's greater than themselves, which is a concept of all major religions. So let's finish this first part on attachment with some practical thoughts. We've talked about the concept of a little bit about neurobiology, about genetics, about instinct. All of these go into factors with attachment. But what happens with a parent and a child is a very human level of either a close connection or a lack of connection between parents and kids. And if you're watching this tape, I would assume that you are struggling or working with a child that's having attachment problems. The first thing, as I said earlier, I want you to hear is that there is hope. The second thing is that we will be getting into some specific areas of things that you can do. It is not all of that complicated on what we want to do to help this situation. It can be extremely complicated in terms of understanding it, but stay tuned. Stay hopeful, and we will start breaking this down to what you do about improving problems with kids that have attachment issues.